Have you ever been in that situation where, medical information just feels like this dense forest,
Yeah.
especially about something serious like cancer?
Oh, absolutely.
Maybe it's for a parent or a grandparent, maybe even for yourself. And the sheer amount of information, the words they use, it can just leave you feeling completely overwhelmed.
It really can. And that feeling, that need for real clarity, for practical insights, it becomes so incredibly important when we're talking about cancer in older adults.
Exactly. And for the people caring for them too, right?
Definitely. It's a topic that, well, it needs more than just medical facts. It needs a deep understanding, patience, and honestly, a lot of informed support from everyone involved.
That's spot on. Because while cancer treatment is, let's face it, complex for anyone, when you focus on older adults, there are these unique layers to consider.
Yes, absolutely distinct layers. And they're not just small tweaks either. They really change the whole approach to care.
How?
Well, it's not just about treating the disease itself. It's about understanding how that disease and the treatment interacts with, the normal process of aging.
Ah, okay. And any other health issues they might have.
Precisely, any pre-existing conditions. And crucially, the whole support system around that person. All these things fundamentally reshape how doctors plan and deliver treatment. The goal is always maximizing effectiveness, yes, but also quality of life.
And that, listeners, is exactly why we're doing this deep dive today.
Right.
We've taken some really comprehensive source material, stuff designed specifically to shine a light on this, well, incredibly important and often quite delicate subject.
Think of this as your shortcut.
Yeah, exactly. A direct route to understanding the nuances of cancer treatment for seniors, the specific hurdles they might face, and maybe most critically, the absolutely essential role of a support system, especially for the caregivers navigating this.
Our mission here is really to pull out the most vital nuggets of knowledge for you. We'll dig into how cancer treatment, particularly chemotherapy, is approached differently for older bodies.
We'll look at the different kinds of treatments available now too, right? Because it's not just one thing anymore.
Not at all. We'll explore those different types, offer some practical, actionable strategies for managing the side effects that can come up.
And really underline why the caregiver isn't just helpful, but, well, a vital part of the whole journey. Like an extension of the medical team almost.
Absolutely. You should come away from this with those aha moments, and a real practical understanding that turns dense medical jargon into genuinely empowering knowledge.
Okay, so let's start there. Let's explore what makes this landscape of cancer care for older adults so, well, unique.
Right. So at its most basic level, cancer involves cells growing incorrectly, uncontrollably. They form masses. Sometimes they spread.
That uncontrolled growth is the enemy, essentially.
Yeah. Yes. And for many cancers, a primary weapon historically and still today is chemotherapy, or chemo, as most people call it.
Now, here's where it gets interesting and what the source material points out right away. While the basic idea of cancer, that runaway cell growth, is the same regardless of age, using powerful treatments like chemo on an older person, well, that adds complexity. The source actually says giving chemo to an older person can be tricky.
That's the word they use, tricky. And it's not just a throwaway line. It's because their bodies often have fundamental physiological differences compared to younger people. It's not about being biased against age. It's about being precise. Precision medicine.
That's a really important distinction. It shifts the focus, doesn't it? It's not just about the cancer. It's deeply about the unique person who has the cancer.
Exactly. And right from that very first meeting, the source material brings in another critical player: the need for a helper, a dedicated person by their side.
And it's framed as essential, not just nice to have.
Absolutely essential. Whether it's a spouse, a child, a close friend, this person, the caregiver, is immediately seen as an indispensable part of the team, active right from the start through every single step.
Wow. So that really speaks to a more holistic view of care, doesn't it?
It does. It acknowledges that successful treatment is about way more than just the medicines and the procedures. It's the patient's whole well-being, their home situation, their emotional state, their ability to actually manage the practical demands of treatment.
Like getting to appointments, remembering pills.
Exactly. A strong, involved caregiver network provides that crucial support layer, making sure physical, emotional, logistical needs are met, and understanding that caregiving is integral, well, that sets the stage for truly personalized treatment plans.
Okay, let's talk about that personalization. Because when we think about treating older adults, the source material makes a really powerful point that kind of pushes back against common assumptions.
It
It really does. It says a person's actual age, the number on their driver's license, 75, 80, 90, is often way less important than their overall health, their activity level, their general vitality.
That's the concept of functional age versus chronological age, and it's such a liberating idea, really.
How so? Liberating.
Well, it challenges that stereotype that just because someone is older, they automatically can't handle rigorous treatment. Think about it. You could have a really active, sharp 80-year-old, still walks every day, manages their own finances, socially engaged.
Right. They might have more resilience.
Exactly. More physical and cognitive reserve to handle chemo and its side effects than, say, a less healthy 65-year-old who might already be dealing with multiple chronic illnesses or significant frailty.
So doctors aren't just looking at the birth date. They're painting a whole picture.
A holistic picture of vitality, resilience, support systems. It's about the individual, not the number.
That makes so much sense.
Yeah.
The real question, how robust is this person right now? Can they engage with life, participate in their own care?
And it means potentially life-saving treatments aren't automatically off the table just because of age. It opens doors.
Okay, so digging a bit deeper then, why are older bodies physiologically, special or different when it comes to handling something like chemotherapy? The source mentions kidneys and liver specifically.
Yes, those are key. As people age, it's common for these vital organs, the kidneys and the liver, to start working a bit slower, maybe less efficiently than they used to.
But why does that matter so much for chemo drugs?
Because think about what kidneys and liver do. They're the body's filtration and detox centers. They process medicines, break them down, and clear them out of your system.
Right, so if they're working slower.
If they're slower, like a slightly clogged drain, the chemotherapy drugs don't get cleared as quickly. They can build up in the bloodstream.
Ah, so they accumulate.
Exactly. And that buildup, that sort of backing up, can lead to increased toxicity. Side effects become more severe, potentially even dangerous.
Which explains why doctors have to be so careful with dosages for older patients.
Absolutely meticulous. They often start with lower doses, watch the response very closely, and adjust. It's about tailoring the biochemical load to what that specific person's body can handle safely. It's a clinical necessity.
Not just a preference.
Not at all. The exact same dose that's fine for a younger person could be dangerously toxic for an older person whose organ function is even subtly reduced. And this ties right into the issue of comorbidities, too.
Right, the other health problems people might already have.
Exactly. It's pretty rare for an older adult not to be managing at least one other condition. Heart issues, diabetes, high blood pressure, arthritis, you name it.
And chemo can potentially mess with those.
It can. Some chemo drugs might strain a weakened heart, for example. Or they could make blood sugar harder to control for someone with diabetes. They can interact with other medications they're already taking.
So doctors have to juggle everything. It's not just the cancer in isolation.
Never in isolation. They have to see the whole picture, the cancer, the other conditions, the other meds, even nutritional status. It's a constant balancing act. Fight the cancer effectively, but don't make the other problems dangerously worse.
Which really underlines why that comprehensive assessment before treatment starts is so critical.
Absolutely essential.
And you mentioned this isn't just a standard physical. The source calls it a special kind of checkup. What does that involve?
It's often called a geriatric assessment. It goes way beyond just blood tests and listening to the heart. It aims to build a complete, functional picture of the person.
Okay, like what specifically are they looking at?
The source highlights a few key areas. First, strength. How physically robust are they really? Can they get up from a chair easily? Do they have the stamina for what can be a physically draining treatment?
Kind of assessing their baseline resilience.
Exactly. Then, memory. Cognitive function. This is huge for safety and sticking to the plan. Can they reliably remember to take their pills? Can they understand complex instructions? Or do they need more caregiver help with that?
Makes sense. What else?
Eating habits. Nutritional status is vital. Are they maintaining weight? Are they at risk for malnutrition or dehydration? Because that can seriously affect how well they tolerate treatment and recover. Dietitians often get involved here.
Okay.
And finally, mobility. How well do they get around? Are they steady on their feet? Or is there a risk of falls, especially if treatment might cause dizziness or weakness or nerve issues?
So they can put safety measures in place, like walkers or home adjustments.
Precisely. Things to prevent injuries during a time when they might be more vulnerable.
So, stepping back, this whole assessment, It sounds like it's the absolute foundation for a safe and effective plan.
It is. It lets the doctors tailor the treatment precisely. They identify the vulnerabilities, maybe the slower kidney function, the heart condition, but also the strengths if they're really active or have amazing family support.
So they can leverage the strengths and mitigate the risks.
Exactly. It maximizes the benefit of the treatment while minimizing the potential harm. It ensures the plan is truly personalized, focusing not just on fighting the cancer, but on the patient's overall quality of life. It's the opposite of one size fits all.
Okay, that makes a lot of sense. And that idea of tailoring leads us right into the different tools doctors actually have against cancer. Because chemo sounds like one thing, but it's really not, is it?
Not at all. That's a great point. Chemo is really just a big umbrella term. It covers several different types of medicines, and each type fights cancer in a unique way. It's not one arrow, it's a whole quiver. Understanding the differences is key to seeing how personalized treatment can be, especially for older adults.
Right, so let's start with what the source calls old school chemo. This is probably what most people picture, right? From movies or maybe experiences from years ago.
Very likely, yes. Traditional chemotherapy, it works by attacking any cells in the body that are growing and dividing really fast.
And cancer cells definitely do that.
They absolutely do. That's their defining feature. So this chemo is very effective at killing them. The problem is...
But the cells grow fast too.
Exactly. Some of our normal healthy cells are also rapid growers. Think about your hair follicles. Or the cells lining your entire digestive tract, mouth, stomach, intestines, they regenerate constantly.
So that's why you get those specific side effects.
Yeah.
Hair loss.
Mm-hmm.
That's the hair follicle cells being hit. And the nausea, the vomiting, the stomach upset, that's the lining of the digestive system.
Precisely. The source uses that great analogy. It's like a powerful weed killer that sometimes hurts the flowers, too. It kills the weeds, the cancer effectively, but it causes collateral damage to other fast-growing, healthy cells.
So while it works, its broad approach is why it can be so harsh.
Yes. Its non-specific nature is a big part of why it has that reputation and why managing side effects is so crucial, especially for older folks whose bodies might have less reserve to bounce back from that kind of systemic hit.
Okay, that clarifies the traditional approach. Now let's talk about what the source calls smarter chemo, targeted therapy. How is this different? It sounds, well, smarter.
It really represents a huge leap forward. Unlike the old school chemo that hits all fast-growing cells, targeted therapies are designed much more precisely. They go after specific molecules, maybe abnormal proteins or genetic quirks that are unique to or much more common in the cancer cells.
So they're exploiting the cancer's own specific weaknesses.
Exactly. The source uses another great analogy here. It's like having a key that only opens the lock on a cancer cell.
Oh, I like that.
So it leaves most of the healthy cells alone.
Wow, that's a powerful image, like cellular surgery. So if it's that precise, leaving healthy cells alone, what does that mean for side effects, especially for older patients?
It often means significantly fewer side effects, and the ones that do occur are often much less severe compared to traditional chemo. For an older person, maybe already dealing with other health issues or just having less physiological buffer,
That's a game changer.
a huge advantage. It can mean they tolerate treatment much better, maintain a higher quality of life during treatment. It might even allow them to complete a full course of therapy that would have been just too rough with the older drugs.
So it opens up treatment possibilities for people who might not have been candidates before.
Absolutely. It's fascinating how science has evolved to make treatments so much more specific, and it points towards a future where maybe side effects are even less of an issue.
Incredible progress. But there's one more category the source mentions: super helper chemo, immunotherapy. This sounds different again. It doesn't attack the cancer cells directly.
You got it. It's a completely different strategy. Immunotherapy drugs don't go after the cancer cells themselves. Instead, as the source puts it beautifully, it helps your own body's army, your immune system, wake up and fight the cancer.
Wow. So you're using the body's own defenses.
Harnessing them, unleashing them. It's about activating the patient's own sophisticated immune system to recognize the cancer cells as foreign invaders and attack them.
That's amazing. The analogy here is great too. Turning on your body's own superheroes to do the job.
It captures it perfectly. It's a distinct and increasingly powerful approach. For some patients, especially with certain types of cancer, it can lead to really durable, long-lasting responses, sometimes even when other treatments haven't worked.
And for older adults, could this be an option if traditional chemo is too harsh?
Potentially, yes. For some older patients, particularly those who might be considered too frail or have too many other health issues for traditional chemo, immunotherapy can offer a viable alternative. It often has a different side effect profile, which might be more manageable for some. It really expands the toolkit doctors have.
So putting it all together, this range of tools, old school chemo, targeted therapy, immunotherapy, what does it all mean for an older person facing a cancer diagnosis today?
It means doctors have an unprecedented ability to personalize the treatment. They can choose the right tool or combination of tools based not just on the cancer type and stage, but crucially on the individual patient.
Factoring in their functional age, those other health conditions, organ function.
Exactly. Their overall health, their support system, even their personal preferences. The goal is always to maximize the chance of beating the cancer while doing everything possible to preserve their quality of life.
But even with these smarter treatments, side effects can still happen, right?
Oh, absolutely. They can still occur. And this is where managing them effectively becomes so incredibly important. How do we help people feel better during treatment?
That's the next crucial piece. And the source starts by just acknowledging that reality chemo can make you feel unwell. These are side effects. But importantly, it immediately offers reassurance. Doctors have many ways to help people feel better.
That reassurance is key. It shifts the focus from just enduring it to actively managing it. So let's talk about some common ones the source highlights. First up, fatigue, often called the biggest side effect.
Yeah, and this isn't just feeling a bit tired, is it? The source says it's a special kind of tired that doesn't get better with just sleep.
That's a perfect description. It's this pervasive, often overwhelming exhaustion, a deep weariness that can really impact everything: physical activity, concentration, mood. It's vital for patients and caregivers to understand this isn't just laziness or needing a nap. It's a physiological effect of the treatment.
So how do you manage something that profound?
Well, the source gives some practical advice. First, rest. Obvious, maybe, but crucial. Respecting the body's need for downtime is non-negotiable during chemo.
Okay.
Second, pacing. Not to do too much in one day. It's about conserving energy, prioritizing what needs doing, understanding some days will be better than others. Don't try to push through it like you might have before treatment.
Manage your energy budget, basically.
Exactly. And then, maybe a bit counterintuitively, the source mentions gentle movement. Taking a short, slow walk can sometimes help you feel more energetic.
Really? Moving helps with fatigue.
For some people, yes. Gentle, low-impact activity can actually boost circulation, improve mood slightly, and provide a subtle lift. It's finding that very fine balance between necessary rest and gentle activity that might actually help.
So managing fatigue is an active process, not just collapsing on the couch. It needs planning and listening to your body.
Very much so. Communication with the medical team is key here, too.
Okay, what about the tummy troubles? Nausea, vomiting, mouth sores, the ones people often dread.
Yeah, those are common concerns. Feeling sick to your stomach, actually throwing up, and then those painful sores in the mouth that can make eating, even swallowing, really difficult.
That sounds miserable and could really affect nutrition.
It absolutely can. But the really good news here, as the source emphasizes, is that doctors now have great medicine to stop you from feeling sick.
Anti-nausea drugs have gotten much better.
Dramatically better. They're often given preventatively now before the chemo to stop nausea from even starting. It's made a huge difference in patient experience compared to years ago.
That's fantastic news. What about non-drug strategies, like for eating?
The source suggests simple things. Soft foods like ice cream, pudding, and soup. Things that are easy to get down, gentle on the stomach and mouth.
Comfort foods, almost.
Kind of. And for mouth sores, a really simple trick. Sucking on ice chips can also make your mouth feel better. The cold is soothing, numbing.
Simple but effective, all aimed at keeping nutrition up and discomfort down, which sounds vital for staying strong during treatment.
Absolutely crucial. Malnutrition and dehydration can really undermine treatment tolerance and recovery.
Okay, now a really serious one. The source highlights getting sick easily, the risk of infection.
Yes, this is critical for everyone involved to understand. Chemo can lower your white blood cell count. These are your body's germ fighters, your immune soldiers.
So if you have fewer of them,
your immune system is weakened. It's a condition called neutropenia, specifically low neutrophils. And it means you can get sick very easily, even from bugs that wouldn't normally be a problem.
And the source has a stark warning here. A fever is a very big deal.
A very big deal. It's not just a sign of a cold. In someone with a weakened immune system from chemo, A fever can signal a serious, potentially life-threatening infection that needs immediate medical attention, like emergency room immediate.
Wow. Okay, so what can be done about this risk?
Doctors can sometimes give a shot to help your body make more germ fighters. These are growth factors that boost white blood cell production.
Okay, that's proactive.
Yes. And then there are the basic, but absolutely vital precautions. Wash your hands a lot. Simple, but incredibly effective.
And avoiding sick people.
Definitely. Stay away from people who are sick. Minimizing exposure is key for the patient and everyone in their household.
This really highlights how vulnerable someone can be during chemo and the need for vigilance from everyone around them. Protecting them from infection is paramount.
It's a team effort in hygiene and awareness.
Okay, one more side effect mentioned. Numb hands and feet. Peripheral neuropathy.
Right. Some chemo drugs can damage the peripheral nerves, usually in the hands and feet. The source describes it as feeling tingly, like they are asleep, or it can progress to actual numbness.
And that's more than just annoying, isn't it? It affects function.
Significantly, the source notes it can make it hard to button a shirt or walk without falling. Fine motor skills go. Things like writing, handling small objects become tough.
And the walking.
Yeah.
That affects balance, increases fall risk.
Big time. It affects your sense of where your feet are in space proprioception. So the risk of falling, which is already a concern for older adults, goes way up. And a fall can lead to serious injuries.
So what's the advice here?
Primarily safety and symptom management. It's important to be extra careful when walking. Being aware, good lighting, clear paths, maybe using a cane or walker if needed.
And are there medicines for the numbness itself?
Doctors can sometimes give medicine to make it feel better, but neuropathy can be tricky to treat effectively. Often it's about managing symptoms and preventing injury.
Okay, so this really impacts daily life and safety. It requires constant awareness and thinking about all these side effects and how to manage them. It seems like having someone there helping, watching, advocating, it's not just helpful, it's almost required.
That leads perfectly into the next crucial point. The source is incredibly direct about this. No one should go through cancer treatment alone. Full stop.
And specifically for older adults.
It states emphatically. An older person with cancer needs a helper or caregiver. This isn't presented as optional, it's foundational.
It really underscores that this isn't a solo journey. So who is this caregiver usually?
Typically, it's a spouse, an adult child, maybe a close friend, someone trusted, someone committed, and the source is clear. A caregiver is a very important part of the team.
Not just on the sidelines, but an active player.
An indispensable player. It's a truly collaborative effort essential for the patient's well-being and the treatment's success. The source then breaks down the caregiver's role into these multifaceted jobs. First, being the eyes and ears.
Okay, what does that mean?
It's about observation, vigilance. The caregiver is often the first person to spot problems. Subtle changes the patient might miss or dismiss. Like noticing a fever, seems confused, or isn't eating. These might seem small, but they can be crucial early warnings of complications. Reporting these changes quickly can lead to early intervention and prevent bigger problems.
They're the frontline observer, providing real-time data.
Exactly. Then there's being the manager. This is about the logistics, which can be overwhelming.
Oh, I bet. All the appointments.
Yes. Managing all the doctor's appointments, providing rides, which is a huge practical help, and critically, making sure the person takes their medicine at the right time. Chemo schedules can be complex.
So they handle the admin and adherence side of things.
Which reduces stress massively and ensures the treatment plan stays on track. Then there's being the voice.
Advocacy.
Yes, especially in the doctor's office. It can be hard to remember everything. When you're the patient, you're stressed, maybe not feeling well.
Information overload.
Totally. So the caregiver can write down questions beforehand, take notes during the visit, and help speak up for the person who is sick, making sure concerns are heard, information is captured, and the patient feels empowered in decisions.
Acting is a crucial communication bridge.
Precisely. And finally, perhaps the most profound role, being the heart.
The emotional support.
Beyond all the practical tasks, a caregiver gives hugs and listens. That simple presence, that comfort, that connection, it helps the person with cancer feel loved and supported, which is very powerful medicine.
That's beautiful. And so true, it combats the isolation and fear.
It contributes enormously to resilience, mental well-being, quality of life. It's deeply human, but fulfilling all these roles is incredibly demanding.
Which brings us to empowering the caregiver themselves, right? They need support too.
Absolutely. The source stresses this. To be effective, a caregiver needs to learn about the cancer and the chemo, go to the appointments, ask questions, be informed.
Knowledge is power for them too.
Definitely. But then comes the crucial reminder. It is a big job, and caregivers need to remember to take care of themselves too.
The risk of burnout is real.
Immense. The physical, emotional, mental toll can be huge. So this is an explicit call for self-care, seeking rest, support, maybe respite care, so they don't burn out and can sustain their vital role. Their well-being is actually crucial for the patient's well-being.
It's not selfish, it's necessary for the whole system to work. They're not just assisting, they are integral to recovery, resilience, navigating the whole complex journey.
Exactly. The patient's success often hinges on that dedicated support. It turns a solitary struggle into a shared one.
It's really a powerful combination of medical advances and human compassion.
It truly is.
So as we wrap up this deep dive, let's just circle back to that core message. Helping an older person through cancer treatment is absolutely a team effort.
A powerful team. You've got the skilled doctors using these advanced personalized treatments, and you've got the dedicated caregivers, the unsung heroes, providing that essential support network.
And the goal isn't just fighting the cancer, right? It's about quality of life.
That's paramount, especially for older adults. Doctors are meticulously choosing plans that aim to help the person maintain a good quality of life throughout the process and hopefully beyond. It's about living well, not just living longer.
And that's the hopeful note we want to leave you with. With a good medical team and a loving, informed caregiver, an older person facing cancer has the best possible chance. The best chance to get through treatment effectively, with dignity, and come out feeling better, maintaining their independence and quality of life.
Absolutely. And maybe, as you think about all this, the detailed care, the personalized medicine, the immense role of the caregiver, maybe the deepest takeaway isn't just the what of the treatment, but the how. How this journey highlights our interconnectedness, our need for mutual support. It really makes you wonder, doesn't it? What insights can these intense experiences in geriatric cancer care offer us about how we care for everyone across all stages of life, especially when they're vulnerable?